Parents, you already know this. This is the time of year when just everybody gets sick. Coming back from Christmas break, there's always a good chance that someone is picking up something. But this year, it's not only COVID, the flu, or walking pneumonia you have to worry about, but norovirus. Our NBC10's JC Monahan joining us in studio. And JC, the CDC just issued a warning about this outbreak. What are you learning?
Well, it's a problem that's been brewing for a few weeks now, Priscilla. The Centers for Disease Control say there were 91 outbreaks of norovirus during the week of December 5th alone, just that week. That's up from the 69 cases that were reported in the final week of November. A norovirus infection is a sudden onset of stomach trouble, often with vomiting and diarrhea. Outbreaks usually occur in areas where people are living close to each other, like nursing homes, jails, schools, even cruise ships. Anyone is able to become infected, but young children and older adults, as well as those with a weakened immune system, can have the most trouble with it. The big concern is dehydration. So as your body loses liquid, you need to replace it or run the risk of having even bigger problems. The majority of norovirus cases occur in the U.S. between November and April. And in 1 year, there are typically up to 2,500 outbreaks, with between 19 and 21 million people getting sick each year. Nearly 500,000 of those infected people have to go to the ER. Everyone remembering to wash your hands well.
Yeah.
Back to you.
All right, JC, thank you. We'll see you in about a half an hour here. Joining us right now is Dr. Shira Doron right now, and the Chief Infection Control Officer at Tufts Medical. Doctor, thank you so much for joining us this evening. As JC was just saying there, right, you got norovirus, COVID, the flu, RSV, walking pneumonia as well. All of these things out in the air, getting people sick right now. Let's say that you've had the shots, you keep your hand wash. You know, is that enough to keep you from catching what others brought back on their holiday breaks? And what else can parents do out there to keep their family healthy right now?
You know, when it comes to some of these germs, you can run, but you can't hide. The common sense things, like you mentioned, like hand washing, it can lower your risk. And vaccines, which we have against flu, COVID, and RSV, they can make the disease less severe. But even the most careful person in the world is going to get a cold, COVID, flu, stomach virus every once in a while, and especially in the winter. The best thing you can do to be as healthy as possible when you do inevitably get sick is eat well, get enough sleep, exercise, manage your chronic medical conditions. Be healthy when you get sick.
Well, talk to us a bit about norovirus, right? I feel like in most homes across America, we just refer to it as the stomach bug, you know, or whatever. Is that what it is? And does it spread in the same way that the flu or COVID or RSV does? What do we need to know about norovirus?
Yeah, norovirus is the most common cause of what's often referred to as the stomach bug, stomach flu, stomach virus. It causes nausea, vomiting, and diarrhea. Now, it sounds gross, but it's actually spread by the fecal-oral route. So not like COVID or flu. It actually gets from one person's feces into another person's mouth. So when you're out and about and touching things, keep your hands away from your face. Wash your hands a lot, but know that norovirus is pretty hard to kill with soap, hand sanitizer, and surface disinfectants, and that's why it's so contagious.
Wow. Well, if there was ever a reminder that we all needed to wash our hands and use Germ-X and everything else. Quickly, how long is someone usually contagious with something like walking pneumonia or norovirus here?
Yeah, unfortunately, people can pass on these germs to others for a week or two after they start showing symptoms, which is why they're so hard to avoid, even if you try to stay away from people who are actively sick.
Well, we have you for another 30 seconds or so, Doctor. What are some home remedies for people who are watching right now? Maybe they're sick, maybe their kids are sick, you know, to treat these viruses. Is there anything in particular that you would recommend beyond what a doctor would prescribe?
Yeah, no, it's rest and fluids. The most important thing I want to share is what not to take. Now, with the exception of walking pneumonia, which is a bacterial infection, everything else we've discussed is a virus. Antibiotics do not work to treat viruses. They have side effects, and they create antibiotic resistance.
All right, Dr. Shira Doron. Doctor, as always, thank you. The Chief Infection Control Officer for Tufts Medical, thank you so much for joining us.
Thank you.